Welcome back to FitMed. Today I'll be talking all about hypothermia and its effects on exercise, but also what you can do to reduce your chances of developing hypothermia and what you can do to help someone who's in need. A lot of the concepts I'll be talking about I have previously mentioned in my last video on hypothermia, so it may be worthwhile having a watch of that before you watch this video. Saying that, let's get on with the show. Hypothermia can be defined as a core body temperature of less than 35 degrees Celsius. Now, this occurs when total heat loss exceeds that of physiological heat production. Hypothermia can be further subdivided into three main categories: mild, moderate, and severe. The first stage of hypothermia is the mild stage. This is where the core body temperature is between 32 and 35 degrees Celsius, and it is this stage you first start exhibiting the symptoms of hypothermia. Now, these can include shivering, a high heart rate, a high breathing rate. You get peripheral vasoconstriction, so you have a reduced amount of blood going to the skin. You develop fatigue and ataxia, which is when you can become uncoordinated, and you get a lack in judgment. You also can develop cold-induced diuresis. Now, this is because you get a reduced amount of blood flow going to the kidneys, and you have a reduced amount of reabsorption because it's an energy-induced reaction. This can result in the start of some hypovolemia, so reduced blood volume, as well as hyponatremia, which is a reduced amount of sodium in the blood. The second stage of hypothermia is the moderate stage. This is where you have a core body temperature of between 28 and 32 degrees Celsius. It is at this point where the body systems are no longer really compensating and start to deteriorate. You can develop cold-induced arrhythmias, so increasing your risk of sudden cardiac death. You can develop hypotension, so a really low blood pressure. Your respiratory rate becomes depressed, so you have a reduced amount of tidal volume as well as a reduced respiratory rate. So not only are you breathing less, you're not even taking in as much either. It is at this point that your lack of judgment can develop into an altered consciousness. So you start to have a reduced ability to respond. So you also have pupils that will dilate and your reflexes become very, very slow. Most importantly to note at this stage is actually you're probably not going to be shivering anymore by this point. And that's a real warning sign of danger. The third stage of hypothermia is the severe stage. This is where the core body temperature becomes less than 28 degrees Celsius. It is at this point you are most likely going to be in a coma. You may have a decreased activity on the ECG, which may result in arrhythmias or even no rhythm with the cardiac strip. The pupils may no longer be reactive to light and are fixed. You may develop pulmonary edema, whereby you get fluid on the lungs, and you are no longer producing urine at all. It is at stage 4 of hypothermia where you have the appearance of death, and you may have absent vital signs. The lowest documented core body temperature which has been survivable is 13.7 degrees Celsius. Hypothermia occurs when heat loss exceeds heat production. Now, this is most commonly occurs when you're in cold environments or wet or windy environments. Any sort of environment where you have increased risk of evaporation, radiation, convection or conduction of heat away from the body. The sports that most people would commonly associate with putting individuals at risk for hypothermia are those that are involved in cold, snowy conditions, such as skiing, snowboarding, skating, all those Winter Olympic sports. Now, you don't necessarily have to be in freezing conditions for hypothermia to develop. If you're in cooler environments where it's wet or windy, which increases heat dissipation from the body through primarily convection. Now, this can include swimmers of all varieties, rowing, kayaking, sailing. It can also include running and cycling, as both sports involve running through air, which increases the wind that's coming at you and therefore heat loss through convection. There are also certain population groups who are more at risk of developing hypothermia during sport. These can include children due to reduced amount of fat under the skin, therefore having a reduced amount of insulation. It can also include people over 60 for the same reason, but also for a lower metabolic rate. These groups also include women who have a greater surface area to body volume ratio in comparison to men. Less physically fit people may not be able to sustain the higher metabolic rates that are incurred due to the cold temperatures for the long period they're out there for, in comparison to those who are much more physically fit. Another population group at risk are those with medical conditions that may impair their ability to generate body heat or affect their thermoregulatory processes, much like with the hypothermia populations at risk, as can those taking medications that also affect thermoregulatory functions. Certain states can also increase your risk for developing hypothermia during exercise, such as being hypoglycemic, having impaired endocrine function, and also having reduced calorie intake. These three states can impair the shivering function, and therefore you have a reduced amount of heat production. As with hypothermia, there are thermoreceptors in the skin and centrally which specifically detect cold, which will send signals up to the brain to the hypothalamus, which will initiate a set of signals to the rest of the body. These signals have two main processes that they enact. One is to enact peripheral vasoconstriction and reduce the amount of sweat production. This reduces the amount of heat you're able to dissipate, but also starts to withdraw blood centrally so that you can keep it nice and warm. However, you do get intermittent partial vasodilation to the skin to reduce the risk of cold injuries. But as you get excessively cold, these periods of vasodilation completely diminish, therefore your risk of peripheral cold injuries such as frostbite increase. With blood drawn away from the skin, this allows the skin and fat layer to act as a layer of insulation, thereby keeping the warm blood away from the cold air. The second process that the hypothalamus works on promoting is heat production. Now this has got a couple of different mechanisms, one of which is shivering. It induces the ability to shiver, which helps to generate heat through muscle movement. Peak shivering tends to occur with a skin temperature of between 17 and 20 degrees and a core body temperature between 32 and 35 degrees. The hypothalamus also stimulates the thyroid gland. Now, the thyroid gland is like a controller of your metabolism. If it is stimulated, it will increase your metabolic rate. And with an increase in your metabolic rate, there's an increase in energy conversion. And as we've learned in other videos, with an increase of energy conversion is an increase in heat production. So there are two main factors you should really be aware of about how hypothermia can affect your exercise performance, even if it's just in the mild stage. Now, the first factor is about how the cold can affect your physical performance. Now, this is about how the muscles can become uncoordinated, particularly when shivering starts to kick in. So if you've got uncoordinated muscles, you're not going to deliver a very good performance. And the second factor is more about your physiological state. When your thyroid boosts your metabolic rate and your energy conversion increases, that's a lot of energy you're now producing, and that requires a lot of resources from the body, so you're more likely to hit exhaustion earlier. And with exhaustion, you get a lack of movement, therefore a lack of energy production, and therefore a lack of heat production, therefore exacerbating a vicious cycle of getting colder. But the most important thing to be aware of, however, is that by the time you've noticed a reduction in your exercise performance, it's already too late to prevent hypothermia. You're already there, you're exhibiting the symptoms, and you've got a core body temperature of less than 35 degrees. The first thing you can do to try and prevent hypothermia is to be aware of your weather conditions. So you need to make sure you look up at what the weather conditions are going to be currently, but also what they're likely to be towards the end of your exercise bout. So you need to make sure you're knowing what the temperature is, what the chance of rain is, the wind chill factor. If you're going to be doing something outdoors and swimming, you need to make sure you know the water temperature. If it's too low, you really should not be going swimming. Secondly, you really need to be aware of your own risks. So if you're female, a child, a bit older, have a medical condition that can increase your chances of developing hypothermia, you need to be aware and take the right measures. You should also be aware of the risk of hypothermia in your particular sport. So if you're a water-based sport or a cold-based sport, you should be aware of what are the chances of you getting hypothermia. If at all possible, you should also avoid prolonged exposure to those conditions. Thirdly, you need to make sure you have appropriate clothing for your sport. If you're doing open water swimming, make sure you have a wetsuit. If you are skiing or snowboarding, make sure you have really thick thermal layers. Now it gets more complicated when you get to the sports like cycling and running, because they're actually massively heat generating sports and you sweat. So it's really important when you're choosing your clothing, which is really important to wear layers, that your base layer is a moisture wicking layer. It needs to be able to draw the water away from your skin, which will reduce your heat dissipation capabilities. Your middle layer should really be a fleece or a wool style layer. This acts as an insulation layer between your wicking layer, but also any external layers. Your outer layer needs to allow moisture transfer as well as ventilation, and it should protect against the wind and the rain. This layer is best used at rest to avoid overheating and avoid wetting of the inner layers. Most of these outer layers tend to sell themselves as being breathable. However, a lot of these styles of breathable clothing will only be able to manage low to moderate intensity exercise rates in terms of sweat rate. When you have a moderate to severe intensity exercise sweat rate, those layers tend to act as vapor barriers, thereby trapping moisture against the body. Again, this plays into the point that these layers should only really be worn at rest or when it is actively raining or windy. One of the worst types of material to be worn close to the body as the inner layer is cotton, as these tend to trap moisture in the material and keeping water against the skin. For your accessories, hats and buffs decrease the amount of heat loss through the head. Although both gloves and mittens are good at preventing heat loss from the hands, mittens tend to be better than gloves at preventing cold injuries to the fingers. The fourth way to prevent hypothermia is to ensure your nutritional intake is adequate. Shivering can increase energy expenditure by 10 to 40%, and carbohydrates are the best to replenish these energy reserves. And finally, acclimatization. You cannot expect to get your peak performance if you're very used to training in a hot environment and then go to compete in a cold one. You need to take time to acclimatize to the cooler environment. The last thing you need in the middle of your race is to collapse from exhaustion due to the increased metabolic demand. Let's go back to the basics. Remember to start with your doctor's A, B, C, D, E. You need to risk assess yourself and your environment. Are you sufficiently insulated yourself so that if you went to go help them, you wouldn't succumb to hypothermia yourself? Approach the person in distress and ask if they are okay. If they're okay and can respond, that's a good sign already. However, if they're not able to respond, it is at this point you shout for help and call 999 immediately. So in hypothermia, it's unlikely the airway is going to be affected. However, if they are unconscious, you need to make sure you put them in the recovery position so they can maintain an open airway. As I mentioned when I spoke about the different stages of hypothermia, you can have two states of breathing. So in mild hypothermia, you can have a higher breathing rate. But as hypothermia progresses, you actually get a depression with your respiratory effort. So they may not be breathing as fast or as deeply, or they may not be breathing at all. As the blood is drawn away from the skin, it can leave it looking very pale and it can be sort of blue fingertips. So it's really important to have a look at their central perfusion. So you can do that by pressing a thumb to the chest or having a look inside the mouth. So if they've got a mild hypothermia, they may still be centrally very perfused. So they may have purple fingertips, but a sort of purpley mouth, but the inside of the mouth is still quite well perfused and pink. Even in the milder stages of hypothermia, their mental status may be affected. They may lack judgment in the milder stages, or they could have an altered level of consciousness. So it's important to be aware of that at this stage. So will they be compliant to your actions, or will you have to get help? For hypothermia, this is the most important part to consider in our primary survey. If they're in a wet or cold environment, you need to remove them from it, and you need to get them somewhere warm and dry. You need to remove any wet or cold clothing because you don't want to carry on the process of hypothermia. So you need to start your passive or active warming. This needs to be much slower than the treatment for hypothermia, which can be rapid. Warming up needs to be a slow process due to the risk of afterdrop. If you do warm someone too quickly, you can make them very unwell, and part of this afterdrop symptoms is becoming very dizzy, lightheaded and potentially fainting due to a low blood pressure. If you have the capabilities, you can do active warming. This is where you can add heat packs, in particular around the neck, the armpits and the groins, where the big blood vessels are the closest to the skin. Shivering is very much encouraged. So if they are not shivering and they have a core body temperature of less than 35, then that's particularly a warning sign for something more serious. We've all seen those foil blankets that they hand out at the end of marathons that help keep athletes warm following exertion. Now they're very good at that job. They keep a warm individual warm in a cooler environment. So if you have a cold individual in a warmer environment, now that doesn't quite work. If they're a cold person in a colder environment, then they are very, very useful. However, you really should make sure you wrap the person in a blanket first, then the foil blanket, and then another blanket on top, as this will help that person to retain the heat they have. But as I said, if they're a cold person in a warmer environment, they're really not very useful, as it actually can prevent the heat reaching that individual. So that concludes today's video on hypothermia. I hope you enjoyed it and learnt a little bit about how to prevent hypothermia, as well as manage it if you ever came across it. With Christmas coming up around the corner, my next video is going to be on how to keep fit over Christmas, covering the common trappings, but also tips and advice about how to keep active over the Christmas period. You can follow me on Instagram at lexi_fitmed, where you can ask me any questions about this particular topic, or you can leave a comment down below. Remember to like, subscribe and ding that bell if you want to be the first to know when the next video drops. Thank you for watching. I'll see you next time on FitMed.